COPD, how pulmonary rehabilitation support patient recovery. Chronic obstructive pulmonary disease, or COPD, is an umbrella term that covers two diseases, emphysema and chronic bronchitis. The World Health Organization confirms chronic obstructive pulmonary disease is the third leading cause of death worldwide, causing 3.23 million deaths in 2019. According to U.S. statistics, more than 30 million Americans have COPD. In the United Kingdom, COPD is the fifth biggest killer disease, killing approximately 25,000 people a year in England. The NHS digital data shows that in 2020 to 21, approximately 1.17 million people in England have been diagnosed with COPD, which is around 1.9% of the population. The worst part is approximately half of these patients are not even aware of it. Unfortunately, there is no cure for COPD, which leaves pulmonary rehabilitation as the only way to effectively manage this illness. In this video, we will cover the positive effects of pulmonary rehabilitation support for patient recovery in the management of chronic obstructive pulmonary disease. What is pulmonary rehabilitation support? The word pulmonary is a scientific language is referred to our lung. The World Health Organization defines the term rehabilitation is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. WHO statistic confirms globally, an estimated 2.4 billion people are currently living with a health condition that benefits from rehabilitation. Rehabilitation is an essential part of universal health coverage, along with promotion of good health, prevention of disease, treatment, and palliative care. Pulmonary Rehabilitation Program describes a biopsychosocial management plan that consists of education, exercises prescription, inhaler screening, oxygen prescription, counseling for mental health, and further referral to specialist care for people with chronic lung disease. The goal of this therapy is to enable mechanical control of your respiratory system, which helps with the physiological symptoms of pulmonary diseases. For instance, dyspnea is extremely common in people with lung disease, either chronic or acute. Being aware of your disease and lungs can help you reduce the frequency of your symptoms. Moreover, pulmonary exercises can aid with inhalation and exhalation, which are commonly challenging for people with pulmonary diseases. Your therapist may also recommend the administration of oxygen, which is helpful in keeping your blood oxygen saturation elevated. Your pulmonary rehabilitation support may be administered by several healthcare professionals, including respiratory physiotherapists and nurse and exercise specialists. How does pulmonary rehabilitation exercise prescription support aid with COPD? COPD has effects on the lung, peripheral muscles, and cognitive functions, resulting in anxiety and depression disorders, resulting in poor quality of life and survival benefits. NHS England's 5-year forward view documents states two overarching priorities with regard to long-term conditions and mental health, as set out in a publication from the Royal College of Psychiatrists. It is clearly stated in those documents that physical and mental health care provision should take place in the same setting, and that mental health care provision should be integrated into existing medical pathways and services, be that primary or secondary care. If we could see the practical healthcare in the UK for COPD, we are failing to implement those statements of integrated physical and mental health care for patients with COPD. However, the current focus of pulmonary rehabilitation for COPD in many settings is to support COPD patients through respiratory muscle training. The purpose of this training is to enhance abnormal breathing patterns. The latter can be the result of an increased work of breathing. Your therapist will also focus on chest wall changes and poor breathing habits. The most common approach to achieve this goal is by including patients in endurance and strength training. By exercising regularly, you can increase a parameter called minute ventilation. Moreover, the constantly controlled movements of your upper and lower extremities can stimulate your respiratory muscles. The result of this therapy is a normal breathing pattern that improves on a daily basis. Eventually, patients become more prepared for potential COPD exacerbations. How does our practice Lung Rehab Voyage and Mind Vibes differ? We at Lung Rehab Voyage provide both respiratory physiotherapy and mental health therapy for patients with COPD. Can you do pulmonary rehabilitation from home? Pulmonary rehabilitation consists of several pillars of biopsychosocial model. You need the help of a professional to learn the theory and practical skills that make a session successful. However, after going to several pulmonary rehabilitation sessions, you may be able to sustain the skill for lifetime management of your COPD condition. We recommend speaking with your doctor before attempting to perform these exercises. Takeaway message: the evidence for the effectiveness of pulmonary rehabilitation support for patients with COPD is definitive. Scientists found that this therapy improves the quality of life of patients and lowers the risk of devastating complications. If you have any questions about COPD or pulmonary rehabilitation therapy, please do not hesitate to leave a comment down below. Reach out to www.teletherapies.org. Thanks for watching.